Get back to.
So today we have a special guest. We have Michelle Hanson, who happens to be the daughter-in-law of Maisie. And Maisie was all excited and thinking, oh, she'd be such a great person to come and talk about. When we've been talking about mental health things off and on, so she would be great. And so I found out a little bit about her. And as you can see, she's a clinical psychologist and neurodevelopment specialist, and works a lot with people of all ages, but a lot with youth, right? Anyway, in looking at the text on the adult ed committee, today's text on realizing that Christianity should be more inclusive seems to fit in, because as we are looking at ways to be reconciling in Christ's congregation, thinking of all the people that get left out or misunderstood, who need the church, who need us, and who we need to really feel kind of complete and whole. So anyway, we're excited to have Rochelle, and I'll just turn it over to you right away.
Thank you for coming this morning.
You gotta talk right into that.
All right, I will not move. All right. I'll try not to talk with my hands and move too much. I can raise it. All right. Can you hear me okay now? Yeah. Perfect. All right. So thank you for the opportunity to talk a little bit about what I do and the people I work with, and what I think can maybe sometimes be thought of as an invisible disability, because we're going to talk about what that means for all of us. So like Carol said, the kingdom of God is intended to be inclusive rather than exclusionary. And we've been encouraged to love one another, build each other up, and love equally. And that, I can't tell you how important that is. Being a clinical psychologist, I have the opportunity sometimes to hear things that people don't often share, even with their closest loved ones. And I can't tell you how much a simple act of kindness can go such a long way, and how maybe an unintended comment or action can go such a long way. People sometimes will talk to me about incidences that happened 30, 40, 50 years ago that shaped their life. A comment by a teacher that maybe the teacher didn't even realize they said, or a helping hand from someone that was just a stranger who gave a smile just at the right time, or looked them in the eyes just at the right time. So those small acts really do make a difference. Sorry, I forget that. So what is an invisible disability? So invisible disabilities are all over. These are things that you might not notice, that you might not know about when you see someone, as opposed to visible disabilities that maybe are more apparent to the eye. And those can include chronic medical conditions, those can include mental health disorders, and like depression and anxiety. Those also can include what's something called neurodevelopmental conditions. And I specialize in neurodevelopmental conditions. That's a fancy word for I like the brain and the people that come with it. So I study across the lifespan. So I work, I would say about 60% children, 40% adult, about evenly split. But I specialize in working with conditions that you're born with and you live through your life with. And so that's why I tend to see people across the lifespan. A lot of these conditions are diagnosed in children, but the truth is, especially with more awareness, more and more adults are realizing that, you know, I might have a brain difference. I can't tell you how many times I'll do testing of a child, and then the parent comes and says, I do this too. No, call me later. Can I get evaluated as well? And I welcome that, because I think any information about how we learn and how we process information helps us know better about ourselves, and we can advocate for ourselves as well. So the youngest child that I've worked with, the diagnosis is about 18 months, and the oldest diagnosis that I've made of a neurodevelopmental condition was an 82-year-old. She's now 86. So very interesting. I saw the granddaughter diagnosed, and the mother of that child said, my daughter is a lot like my mother. And she asked her mother if she'd be willing to go through, and her mother indeed met the criteria for autism. But was at an age where autism, high functioning autism, or sometimes known as Asperger's, would not have been recognized back then. But it really helped reframe maybe some of the ways that she acted as a mother, and it affected. And her daughter was able to have compassion about how that was affecting her view of her childhood as she was raising a child with the same condition. So, and again, her mother, successful real estate agent, successful, a church community member, and had an invisible disability that people didn't understand. And it's hard sometimes to understand. So the neurodevelopmental conditions that I work with are considered. Now I would put this whole list up here and seeing if you maybe recognize some. So common ones are maybe ADHD or autism. Those tend to be my biggest referrals, but these are all different types of diagnoses that come, or conditions that you're born with. And they might show up or look differently at different ages and stages, but they are things that science has shown us that they begin before birth in our development. What's interesting is that many times the people will ask me, what causes these things? And we know that there's a combination of genetics and environment that are to play for why the brain would have these conditions, or why the brain would go ahead and see these conditions. Does anybody recognize any of these disorders? Oh yeah, absolutely. They are becoming more and more, I think, more and more apparent, more and more, what would I say? More and more, there's less stigma, I think, in some ways, which is a good thing. But we know that about 18 to 20% of the population has a neurodevelopmental condition. So that's like 2 in 100, and actually those numbers are probably low because a lot of people have not been that formally diagnosed with neurodevelopmental conditions. Estimate is more like 35 to 40%, which makes you start thinking about what is normal, right? What is typical, right? And so I really want you to kind of challenge that idea today of like, what is normal, and what is a typical brain? And these conditions will affect cognition, so that's brain, communication, the way we communicate, adaptive behaviors, those are how we live in the world, psychomotor, so how we see things, and then how we turn that into hand or actions. And you're born with it and you grow with it. So they do tend to run in families, so there does suggest a genetic component, but we understand that there's many factors that can contribute or turn on those genes for neurodevelopmental conditions. Does anyone have any questions about some of these disorders that I have up here? Okay. So, and like I think I saw every person bob their head, yes, that this is something that they've seen or is familiar with. So one thing that I've extra specialized in is these disorders all have something that's common. And what's common is the front part of our brain. This is called the frontal lobe. And this is the only time I promise to get a little brainy on you, okay? But I think it's really interesting and important. So the front part of our brain, that is what we call the executive functioning. And what I was finding in my practice is that I was teaching people things in therapy, but it was difficult for them to make it into action. And I knew from my studies that the front part of the brain is what makes us have actions. We can maybe understand something, but to actually do it, to plan out, to prioritize, to manage our time, regulate our attention, to sustain that energy over time, to complete and follow through. Think of all the things that have to happen to actually carry out actions to live, carry out actions to learn, carry out actions at work, at school, at home. So what I was finding is my patients, even though their disorder or conditions were different, they had this common theme, and they were having a hard time kind of showing up in the world in a way that consistently. And what the reason why is because they all have what's called executive dysfunction. So executive dysfunction, is that working? Steve, do I need to pause?
Just
Oh,
making sure this is
being done. Perfect. Awesome.
clear for the Zoom people.
Yeah, oh, that's a good point. I'm gonna keep talking. So executive dysfunction is mediated by our front part of our brain. I like to call it, well, it's called the executive. Somebody long before me decided to make that decision, and that's okay, because they're trying to say it's like the boss. So a lot of times, not every time, but a lot of times you have a boss that maybe doesn't do the job, but directs everyone to do the job, okay? And so is that ready? We good?
Yeah.
Perfect. All right, thank you for changing that. So the executive tells the brain what to do. I like to think of it as a conductor or even maybe a chef. So think about this. I don't cook. Everyone knows who knows me knows I don't cook. However, so when you think about cooking, you think about the chef, you think about the ingredients, and you think about the recipe. You think about what you need to make a good meal, right? So if you're a chef, you might have great ingredients, you might have an okay recipe. But if your chef is tired or distracted or has injury or hasn't eaten right, then that chef doesn't show up to be able to make a good meal, right? If you don't have a good recipe, like what to do, I can't cook without a recipe because I'm not that one of those intuitive cookers, but if you don't have a good recipe, that also can make it difficult to make a meal. So what happens is we have people who have abilities, they have good ingredients, but they're not always able to consistently follow through, make that good meal, follow through in the task at work, follow through with taking care of themselves at home, or follow through with being able to understand and learn a concept. And that's oftentimes because that chef or that front part of their brain is showing up inconsistently. It can be very frustrating for the person and the people around them, because people think, well, you can do this, or you did this yesterday, or you can say it back to me. And then a lot of times what will happen is we turn the inward. Well, what's wrong with me? I mean, really, it's a brain-based behavior. The good news is that it can improve across a lifetime as the brain keeps developing. The interesting news is that part of our brain is not developed up until ages 25 to 30. Okay, long after a lot of people have launched into adulthood, right? And so when we say, like, someone's struggling to kind of get launched, I always think about, have we our expectations sometimes of what we expect a brain to be able to do at different times. So we'd never be angry at a toddler for not being able to run or do cartwheels, because you would understand that that toddler is just learning to walk. And yet we can get really upset and angry and frustrated with especially young adults who we expect them to be running faster than their brain allows them to. And so I think that probably is one of the hardest things and the most conflict that I see within families is expectations of what, and the person themselves, of what their brain can do versus what they're able to do consistently. And on top of that, injury, illness, pain, stress can make so that chef, that front part of the brain, makes it even harder. So then if you have a neurodevelopmental condition and then you add in kind of those everyday stressors, it makes it hard for all of us for that front part of our brain to work. So it's an interesting concept. So things that can help us kind of function in the world. I found that this was so prevalent that I actually started a specific protocol just for helping people with executive functioning and giving them strategies and skills. And in fact, ended up branching that off to a different form of business as well. So I have a clinic, and then we started a center to help give coaches to people to help kind of guide them and help them with these executive functions and to teach them strategies to work around and teach their parents, their teachers, their family members, their partners. And we started off seeing kids, and actually now we're seeing it's equal, half children and half adults. So it's definitely a need and a good support for people. And people will have these aha moments of, I just thought I was stupid, or I was just told I was being lazy, or I was told there's no hope. And so again, today is being able to talk from a Christian standpoint, think about how those messaging and how that can affect what people believe of themselves. All right, so can you tell, and No, you might have to go back. You can just pop, if you just go forward, you can do it for me, maybe. Maybe not. There you go. All right. Can you tell me who on these pictures have a disability? Exactly. You cannot. And I think that's an important thing to remember. So people will say, well, how can I tell? Like, and this is what I want you to ask yourself. Does it matter? Does it matter? I mean, shouldn't we be treating all with respect and all with dignity? And should we meet everyone, understanding that everyone might have a skill deficit or something that keeps them from maybe doing and showing up the way they want to show up, right? It doesn't matter, I think. Let's see if that works. I'm gonna click Steve. Okay. Sorry, Steve, you're gonna have to stand there for a little bit. Yeah. And now, oh man, everyone's gonna see the don't look there. That gives away the answers. All right, here's a minute. I didn't think about that. All right, so I'm gonna, it's okay. It's okay. All right, so I wanted to kind of go through a little bit of myths. Because I hear them a lot, and these are some, not all, but we're gonna have a little bit of a discussion. So first of all, a lot of times I'll hear, because I set up vocational, academic and work accommodations. So things that help people with neurodevelopmental conditions be successful at work and school. And sometimes I'll hear like employees with disabilities are less productive than those without disabilities. And actually research shows exactly the opposite. There's no difference in productivity between those with and without disabilities. So Steve, I'm gonna need you to click it. Sorry, Steve, you're gonna have to stay on top of this one. Sorry. Just leave it. Oh, okay. All right. Thanks for that. So research shows that there's no difference in productivity. And in fact, research shows that the person with that invisible disability, because so many people don't understand what they're dealing with, will actually work much harder at the same job, putting in more hours to be able to make up for their disability, their invisible disability. All right, Steve. All right, persons with developmental disabilities cannot play sports. I think we all know, right, Steve, I'm gonna click. There are over 5 million Special Olympic athletes around the world. We have a very strong Paralympic program as well. And there's estimates that athletes in general have a higher rate of neurodevelopmental conditions, probably most likely because it was a gift and a strength of theirs that was maybe looked at in the school environment when maybe learning was a little bit harder for them. And so there's a higher rate of athletes with neurodevelopmental conditions. Because sometimes our schools give messaging that only one type of person can learn and only one type of person is smart. And hopefully we can come away challenging that idea a little bit, especially in our communities. All right, Steve, go ahead. There's some people will think that nonverbal autistic people cannot understand what you're saying. If we have time, I might show you a video about what they can use. So that click. All right, many nonverbal autistic people have high intelligence and they use a communication device to express themselves. We're gonna I think we have time. Yeah, we have time. Go ahead and click that. We've got time for that. Can you click onto that? Let's see, one more click. Yeah. All right, so this is going to be a story. This is Carly Fleischman, who was one of the first nonverbal autistic women to be able to use a communication device to tell what she was thinking. And now this is a pretty significant case of impairment. Is it going to let you play it?
Let's see.
Maybe if you click one more time, it will. Maybe we could click one more time. Yeah. Maybe not. All right. Well, I can just tell you. It's okay. All right, so I'll just talk to you about it as Steve's working on it. I think if you go back, Steve, and then just put enter, it might just play automatically. At least it doesn't. But that's okay if it doesn't. We can just talk about it. So Carly Fleischman's parents felt like she had something to say. She's nonverbal and kind of your traditional autism where hand flapping and moving, banging herself on the wall, being able to really have difficulty showing up in the world. So we developed about in the late 80s, we developed these tools to allow people who couldn't communicate. Autism is a communication disorder. People don't realize that and so even people who do speak words have a hard time communicating nonverbal or social cues. And so Carly Fleischman's parents worked with people to develop a communication tool. And she actually was able to go on to go get a degree, and she's written 2 books, and she holds a blog, right? It's incredible. We actually learned a lot from Carly Fleischman being able to tell us what is it not working? It's okay. Fine, we get the pass. We'll keep going. It's okay. She, in her book, she goes on to describe what it's like to be in her body. I really encourage you to even get on her blog and maybe watch some of the early videos that her parents have of her. So she's able to say, I bang my head because it feels like my body is on fire. Sometimes I want to stop flopping my hands, and it's almost as if my hand is doing its own thing and I can't control it, right? I try to get words out and they get stuck, and so they come off as a scream. Again, I think this is really impressive. If you read her book, she ended up studying sociology, and she does a whole thing about how many people are ignored or misunderstood, and how we all have different intelligences, and how we sometimes aren't able to communicate that. So it's an impressive story. It's okay, Steve, we can keep going. That's okay. So that was mine. All right, we can keep going. It's okay. Okay. There's an old 2020 episode on her if you want to look it up. Carly Fleischman on the internet. All right. Okay, here's another one. Workers with disabilities don't have the skills, training, or education required for many jobs. Okay. Go ahead, Steve. I know, I'm sorry to make you work. You earned your pay today. All right, so over 80% of adults with a disability have completed post-secondary educational programs. And I actually think that that's really a credit to our society. In United States, is I think in other countries that I've lived in or learned about, and I think the United States does a great job of making post-secondary education accessible to many people, going at your own pace or getting the accommodations that you need. But also remember that neurodevelopmental conditions are those that many of us in this room have. So are high achieving, have fancy letters after a name, etc. And I think keeping that in mind, that everyone's brain works a little bit differently. This was interesting. Employees with disabilities have a high absentee rate. Go ahead, Steve. So actually, when we go through and do studies, we find that employees with disabilities do not miss any more work than their coworkers without disabilities. And I like to point that out. That's same with school as well. Students with nonverbal or neurodevelopmental disabilities miss less school as well. Part of it is knowing these patients intimately. Part of it is because they're trying so hard to kind of show up typical. And so they're trying so hard to compensate. And oftentimes it's at the detriment of their mental health or their physical health, but they're trying so hard to show everyone, I'm just like you. And the truth is they don't realize like that typical worker is also taking time off for appointments, is also having a break day, is also coming in a little late on if they're not feeling their best. I get this one a lot. People with autism are rude. Now, so Carly Fleischman is maybe an example of someone with nonverbal autism, but autism is a spectrum, and you would be surprised at how many people have features of autism or high functioning autism, what we used to call Asperger's as well. A lot of times people will come off maybe rude or cold, and people will think that about them. But really what it is they interpret interactions differently, and they communicate differently. So the brain lights up to different ways to communicate with the other, in the way we use facial expressions, hand gestures, posturing, all of those things. think about how much of communication isn't just what we say, even tone and tonality, how someone might use a flat tone. I get that a lot. Or I get the opposite when I diagnose with someone with autism. They're like, oh, but my son or daughter is caring. They have empathy. It's like, wait, hold on. Who said that people with autism can't be caring or can't have empathy? In fact, some of the most heartfelt confessions and therapy have been with people on the autism spectrum who care so deeply about someone. They're very loyal. Their brain makes them so they can be very, very, really focus on the people in their life and really wanting to kind of communicate and have sadness that sometimes there's misunderstanding in that communication. Think about if I took you right now today and took you to Brazil, right? You would struggle to communicate. And even if you spoke Portuguese, you would still struggle to communicate, right? And that's how it is to have autism. It struggles to communicate. We have to kind of work around it. You might get misunderstood. I know when I lived in Japan, I said words that apparently were bad words and I didn't know it, right? I didn't maybe use the nonverbal cues that they did. One of my favorite ones is my son, he was a toddler when he lived there, and he would do this, because that's what people in Japan do. It's like their way of like saying, I'm listening, listening. So he came back to America and it looked like he was agreeing to everything. Yes, I'll do that. Yes, I'll do that. When really he had just learned this habit. So lots of ways that we communicate and maybe are misunderstood as well. So I like to remind yourself that that's a communication disorder. Go ahead, Steve. All right. People with ADHD cannot focus on anything for a long time. Actually, the fact is that ADHD is an attention disorder, attention regulation disorder. I get asked this, and they can hyperfocus, meaning really, really focus on one thing at a time that's rewarding. So ADHD actually is not an attention deficit disorder, meaning they don't have attention. What it is that sometimes they have too much attention. I like to say, when I explain it to someone, I like to explain it's like their brain is a stage light and it has a hard time with the spotlight. So think about if you were having a play and the lights are on the whole time, and we wanted to really pay attention to the person giving the monologue or an act where it's a beautiful song, but we kept the lights on the whole stage, and you saw the people moving the sets, or you saw people moving around, or you were distracted by the couple over there, doing whatever for part of the play, you would be distracted. And that's an ADHD brain. It has a hard time bringing in that spotlight, but once it does, it can get stuck there too. And so that's why it looks like, well, wait a minute, that my grandson can focus on Legos. Why can't he focus on me when I've asked him to do something? Well, no, sorry, Grandma, Grandpa, but sometimes you ask them to do something isn't as preferred as those Legos. And so they're hyper focusing and they've missed all the other things. Or then when you get them out of that play trance, that hyper focus trance, now their brain has seen the whole stage. So now their brain is trying to bring in the feeling from their sock or shoe. Now I just said it, right? Now you can feel that shoe on your foot, right? Your brain was thinking that all along, but your brain knew that's not important. Don't pay attention to it. It's not that pathway has been broken. So think about, if we're thinking, what is that sock on my shoe? The click of the clock, mom talking, the TV. Think about all those things that could be on the stage, and then having a brain that doesn't know which one to kind of focus that onto. So I get a lot of questions about ADHD and attention and how that shows up. Perfect, thank you. People who cannot read have an intellectual disability. So reading abilities are separate from intellectual abilities. So you can actually be gifted, which is high IQ, an IQ of over 125 or more, and also have dyslexia, which is a reading impairment. That we actually call those types of students called twice exceptional, or 2E students, if you ever hear that. It means twice exceptional, meaning they're gifted and they have a disability that impacts their ability to show up as a student. Probably one of the most profound testing I ever did was, well, I'm not sure I've done some profound ones, but one that always stood out in my mind was probably because it was early in my career. When I was still in graduate school, we had an assessment clinic that I ran or worked at. no, I ran. The professor ended up being really sick and having to be in Mayo, so I ended up running that clinic for him. But it, there had been a request, a vocational request for a new professor at University of North Dakota to run. He was an art teacher and he was well known for his pottery. And UND, I didn't know this until I went there, it has the oldest working kiln in the US. Yeah, I know. Lots of people come up to use it because I guess because it's so old, it does something. I don't know anything about pottery. So if you do, you can talk to me later. It's fascinating to me, but apparently it does a certain type of glaze or something that it's really hard to do because of this old kiln. And so people argue, believe it or not, they vie to live in Grand Forks to get a job at UND. Mind blowing. I kid you, it was a great place to go to graduate school. Lots to do, like study. So, however, with that, probably one of my most memorable. So this professor had moved up, and he was really struggling to keep to get the grades in the grade book and to do some of the academic part of being a professor. But he was a famous potterer. And he had asked for accommodations because he said, you know, he was probably in his late 40s. And he said, I actually think I have dyslexia. It's just never been diagnosed. I was asked to do his testing. He had 148 IQ, which Mensa is 150. He had 148 IQ. That's a 99.5th percentile. So out of 100 people, there's only half a person smarter than him. That's a kid. That's a joke. This means like he's it, right? So, and his reading ability was at a first grade reading level, right? And it wasn't because he hadn't been in school, although he had lots of stories of telling how many times he was told how stupid he was and how he wasn't trying. He actually had repeated 2 grades twice, which repeating grades when you have dyslexia doesn't make you still not have dyslexia. So he had all this messaging around him. I don't know how he got his master's. Well, he did tell me he would pay people to read to him, because it was before we had technology to be able to read for him. And was incredibly talented. He actually, I wasn't allowed to accept it because we can't accept gifts, but he had made me, in the time of testing, he had made a mandolin and was like, you can have this if you want, I just make them. Right, so incredibly intelligent and yet profoundly impaired in his ability to read. So we got him a scribe and an assistant to help load his the academic side of grades, and he did great. So that tells us that a reading disability is separate from that giftedness and intellectual ability. ADHD is separate from intellectual ability. Dysgraphia, which is the difficulty to write, is separate from intellectual ability. Bipolar is separate from intellectual ability. All of these things that we think that maybe impact intellect, and actually they're separate. What happens is we can't always show what we know because of that frontal lobe, because of that front part of our brain. And here's with persons with bipolar are just moody and can stop taking medication whenever they feel better. I get this a lot with bipolar because when on medications, people seem pretty typical, right? Things are going well. And that's usually when people go off their meds. And it's because, go ahead, Steve, I'll show that. So bipolar is a medical condition. It affects 2 to 3% of the population. We know that there's brain chemical imbalances, disrupted sleep, and gut issues, pretty profound gut issues. There's some really interesting studies out of Hopkins using probiotics to help support medication and even reduce manic phases within the bipolar population. Interestingly enough, autism has the same, and schizophrenia has had the same research shown. So we can talk about that offline if you want, about gut health and all the things to do to help our guts, because that's our second brain. So these are treated by a combination of medication and therapy. So bipolar is not just moodiness and does need help because of that chemical imbalance. It's a salt imbalance in our brain. And then kids can outgrow ADHD. Go ahead, Steve. Well, ADHD is a lifelong condition. Adults, by the time you're adults, you can learn to better adapt. And thus ADHD might be not as noticeable, but that doesn't mean that there's not a lot of struggle and work to show up functionally in the way in the adult world too. And I like to remind people of that because we used to actually think that you could outgrow ADHD, and we're finding from fMRI studies, which are scans of the brain, no, We just learned those strategies to kind of compensate. Sometimes those strategies are effective and make us more efficient. And other times they're ineffective and a lot of work and can create a lot of burnout and stress to do the same work maybe with next to somebody who does not have ADHD. And then last, I wanted to think about this idea that neurodevelopmental conditions are caused by poor parenting. And sometimes, I mean, not even poor parenting, but I have parents ask a lot, like, is this something I did? Is this something that's that I could have prevented? So what, neurodevelopmental conditions, like I said before, have a biological, a genetic, a psychological and social factors that contribute to the development, but also how that presents or turns up. This is where I get to kind of pull in some scriptures right now, because I want us to think about, when I think about, when people ask me that question, like, did somebody do something wrong, or did I do this as a parent, or did I make this worse? I think about how in John 9, how Jesus was walking through the disciples, and there was a child that was blind. Do you remember this story? And the disciples asked, like, is the parents sin? Did the parents sin? Is that why he's blind? And I always think about how Jesus answered that question. He said, if you remember, he said, neither the parents nor the parents sin, that he is that way to show God's work in him. And I always think that's really interesting, because we all have differences, and we're born with such a variety, and I think beautiful differences that make us part of a clan, part of a community. And when Jesus didn't say, I made that so we could have work through him, we said, I make it to show my work. And I think that's really important, that to show that God's work is in the beauty of our differences. Really, it's the masterful creator of that. And I think when we can think about, when we stop laying blame for why maybe people are different, or maybe even stop looking for reasons, and we just say, okay, I'm here, we're here, how do we go forward with that? So thinking about not asking that wrong question, just not thinking about just do what Jesus says, but he said, there's something to do. There's something to do. There's not something to serve or judge. There's something to do. So how can we do that? How can we be inclusive communities for people with nonverbal differences or hidden disabilities? I have a few ideas, and then we'll talk. Because I find a lot of people have questions, maybe of things that have come up in their own life. Go ahead. So first, the first one is, here we go. We want to build awareness. So you are here already. Check. You guys are already on the path of building awareness. I always like to use that word. Sorry, that's really small. Sorry, guys. Curious compassion. Have compassion and be curious. Ask. So because many of these neurodevelopmental conditions are invisible, but also on the spectrum, meaning that they can look different in different people. Don't make an assumption of how that neurodevelopmental condition is affecting them, right? So don't make an assumption, ask them. Ask, you said you had ADHD. What does that mean? You said you take bipolar medication. What does that mean for you? What does that mean for you? When I work with patients and parents and their children, we talk a lot about self-advocating. And I just did this yesterday with a big parent group, and we talked about, don't start with, my child has autism. It's okay to do that, but follow up with, that means that she may get stuck and have a hard time shifting to the next routine. So if she does, give her a minute, or you can call me, if you need some help, but just know that that's her brain. She's not trying to be disruptive when we switch routines, but her brain may get stuck. So because if I just said, my child has autism, we all have an experience. And so we think that that's going to be the same. So make sure to ask, if someone says, I have this, or if you have a loved one who says, I have this, or you yourself has a neurodevelopmental condition, make sure to explain how that impacts you and then how that process is for you. Another piece is, don't judge people using that neurotypical standard. Like I said, what does that neurotypical mean? I mean, rethink what is acceptable behavior. acceptable communication and presentation. I want you guys to go look up Carly Fleischman. You will be amazed about the books and the things that she has. And you see this child just kind of tortured actually by this body that won't comply. So think about, I also like to say, make sure you label the behavior and not the person. I believe this for anything. So, you know, I'll say, so a child's being naughty. I have 5. I have 8. I have 3 steps too. Luckily, so most of them are not naughty all of the time, right? So, but also remember, naughty is defining that child. That behavior, all right, my child is having disruptive behavior. My child used a disrespectful tone. It's okay. I'm not saying that we need to accept behaviors that we want to help people with, to help them maybe feel better about themselves, but be careful that we're labeling the behavior and not the person. It's a really important piece. Really important piece, because remember that person, that child, that parent, that neighbor is just being themselves. And so keeping to mind to let them know maybe what's not working for you. It's okay, or what you might not understand. The other one is believe people when they tell you that their struggles. Oftentimes, I think what we do is we want to ease their pain, right? So we'll say like, oh, it's not that bad, right? It's not that bad, or it could be worse. Sorry, Region Minnesotans, you guys are the best at that. Like, it could be worse, like, right? It's 25 inches of snow. Well, you could be also blowing, right? Right. And we do that, and I know why we do it. We want to like ease that pain of this person that we love, right? But also understand when we minimize, it makes that person feel like you don't get me. And so they disconnect a little bit more. So just stop for a minute and say something like, that must be hard. Tell me more. I'm curious to know what happened there, or how I could have shown up differently for you. These are great questions to ask, because they help us say like, I hear you, I believe you. I might not understand that struggle, and I might not even see it, but I'm here for you. It gives the same thing. I understand when people say, oh, don't worry, or it's not that much, or it can't be that bad, or you're doing so great. I get why we do that. I try to teach my patients why people do that, because they want to decrease suffering. But I'm also saying that we can be better at saying, yeah, that must be hard, and you did that. Sometimes we just need to validate. We don't have to fix it. And then I think another important part is to focus more on serving rather than serving them, but to serve with them, giving all abilities an opportunity to minister and lead alongside one another at the church, in church and ministry. I think that's important, really important, that making space for everyone, not just to serve, but also serve with. Because like I said, this is God's work, right? God's work is in the differences, not necessarily the disability. So it's important to think about. So I know that your community does this, and I only have a few pictures, so don't be offended if you're not in there. But I want us to have a conversation about how that might show up in our world, how we as a Christian community can embrace and understand within and I always say it always starts at home first and then to our community. So how do we show up, and maybe even what are some experiences people have had where they felt supported if they do have an invisible disability. So I've left a little bit of time for that. And I want you to kind of think through that. So with that in mind, does anyone have any questions, or maybe want some help and understanding about neurodevelopmental conditions, or how that might impact the community or even your own family? Go ahead.
I think you've kind of blown up the whole nature versus nurture discussion a bit here. I don't know if you work in this field at all, and maybe I'm taking you on the wrong path, but how about things like gender dysphoria and stuff? So there's a lot of discussion today about, well, I was born this way or whatever. Does that enter into your discussions?
That's a good question. So the nature, let me come back to two. I think there's a two-part question. So the nature versus nurture. So what we found, you're right, back in the kind of more like the 60s and 70s, psychology really took a split between like Watson and Skinner really said, in fact, I think Watson said something really bold, like bring me any child and I can make him a criminal or a leader. And by the way, Watson's children don't have interaction with Watson, just so you know that. He did not didn't succeed in making connections with his own children. And so for a long time, we thought if we just taught the right behaviors and maybe these showed up because someone didn't do that. Then there was also this other piece of before that, it was just completely about nature. Well, that's just how they are, just leave it. And there's nothing really to do. Thankfully, but we've learned that there's a very complex combination, we're still learning, of both. So you actually have these silent genes in your genetic makeup that can be turned on by things in your environment, like stress, environmental toxins, trauma, in utero stress, environmental toxins and trauma, and even during those critical phases of development in your environment as well. So it's a both. It's a both. The theory is called the kindling effect, and we see this the most in schizophrenia, but we can also see this in bipolar and other ADHD. I've seen it in autism, which means that it's kindling. So it's the little embers that are sitting there, and they're always there. But then if we turn in something like give it some extra oxygen or fuel, then it flares up and is apparent. So we'll see that. So that's why we learned that from the twin studies where we had two identical twins and then one would develop, one would not. And they would look at like how the genetic makeup and maybe things that had happened in the environment to turn some of those things on. And that isn't just environment of people, how people treat them, but also exposure to toxins and foods or even an illness that could have turned those genes on. That's the nature versus nurture. So it's that complex kind of interaction. Gender dysphoria, we're still learning a lot about gender dysphoria. We know that there are approximately, and I think you guys talked a little bit about sexuality last week, and maybe some of this came up before. You know, Maisie included me in a little bit on some of that discussion. So gender dysphoria, we know that there's approximately 12 to 15 genes that determine gender. So if you think about all of the genes that are turned on or off to create what we would present as gender or gender anatomy, or gender presentation, there are a lot of genes that can be turned on and off, right? So if some are turned on and some are not, there's a chemical difference. And we can see that in those hormones that are kind of exhibit as young adults and adults. Oftentimes we find that people who are promoting or diagnosed with gender dysphoria, saying things like I was born this way and I feel different than how people see me or the gender I've been assigned. Oftentimes we can see that those genetics, those that we've been able to do studies on, that the genetic makeup of their gender is different and their hormones are different. So there is a genetic component. And people ask, well, you know, is society creating some of this gender dysphoria? And again, I think it's a complicated question in that we have things that can turn on, or even allow to have that discussion about. I am never going to pretend that I am smart enough to know what someone's experience is. And partly because a lot of conditions that we have now, a long time ago, were thought of as just in your head, which I think that's really interesting to me. As a psychologist, I'm like, if you had asthma and they're like, it's just in your lungs, I'm like, yeah. And then when I would get called into a consult in an emergency room or a hospital, and they're like, well, nothing's wrong with you, it's just in your head. And here's Dr. Hansen. It's not a great warm up, by the way. Well, yeah, it's in our head, just like asthma's in our lungs, but it also affects the whole body. So gender dysphoria is one of those that we're still learning about. For instance, fibromyalgia about 40 years ago was considered a mental health diagnosis. We didn't have evidence of biomarkers, and now we have lots of evidence of biomarkers that fibromyalgia is not just in your head. So I think we're still learning about the complexities of gender dysphoria, but the research is showing that those that we have been able to have genetic studies on and follow them through, we're able to go ahead and say, yeah, there's a chemical component. I hope that, is that my marker to tell me? I was like, Louise, thank you for helping me. Louise is my daughter's lovely, my son's lovely girlfriend, and she's helping me stay on track. She knows I talk too much. Okay, so that's the gender dysphoria part. But it is interesting. It is really interesting how we're learning about. And one of my favorite ones is hysteria, which was back in the 1800s. It actually literally means wandering womb, wandering uterus. I don't know, ladies, if you're having that wandering uterus day, that's a tough day, right? When really it was, what we found out was biochemical imbalances for people with mental or major depressive disorder or bipolar as well. So we're still learning. We're still learning, and gender dysphoria is a new area that we're still learning. I hope that
Yes, thank
did
you.
not, and maybe did answer your question. A great question, great question.
I work a lot with people with trauma and brain, and what happens with them when somebody gets triggered from either abuse or neglect or any of that stuff. And so all of a sudden I'll find myself shutting the brain will be shut down or else stuff. You know, the brain stepping up going to fight or flight or anxiety. How do you calm the body so you can get that kind of low?
I love that question. Okay, so she asked, like, how does trauma make it affects the frontal lobe? Absolutely. And like, how do we connect with somebody who's maybe having a trauma experience or their body's reacting to their trauma? So it's a great question, right? The body keeps a score. Okay, the body keeps the score, meaning that body remembers sometimes faster and more accurately than our brains do, and that's protected. We don't want to think about our trauma all the time. But the body has this reactive response. And so what happens, you're exactly right, Susan, that what happens is that frontal lobe, that part that helps you make decisions, plan, be attentive, it ends up, when we are in a trauma trigger, it ends up pulling blood, pulling glucose, which is the way that our brain works, the pupil of our brain pulls it away from the frontal lobe. So why do we do this? Let's think about back to cave time, cave people time, right? Our biggest traumas or worries or dangers were, you know, the woolly mammoth that's going to eat us, right? Or something like that, or looking for food. And so what happens is if we have a danger, our body, actually blood comes into the middle section, it moves away from our arteries, because if that saber-toothed tiger chomped off your arm, then you wouldn't bleed out. That's how we were designed. Your math test doesn't usually chomp off your arm, you know. Driving, think about driving. I always think about it. If a cave person came in the middle of our day and had to sit and driving, like that would, what are we doing? But think about all the complexities of driving even. And so what happens is that front part of the brain gets shut off so that the glucose or the fuel can be able to work on survival, on just survival. So one way to work with people who have a trauma history is to be able, and trauma history can also exacerbate these neurodevelopmental conditions and actually can be a contributor to neurodevelopmental conditions, is to be able to calm that body first and then connect. So connect with that emotion and then go ahead and try to use that logic brain or that solving brain. If you start with problem solving and you start with planning, guiding, any of that, that brain is not hearing you. So first connecting, so sometimes just see that you are wound up. What's going on there? We're, as humans, we're wired to kind of match each other. Have you ever walked next to somebody and pretty soon you're both walking at the same pace, right? Breath is the same way. If you go like this, because we'll mirror each other. So that person's kind of spinning. What do we start doing? We actually start spinning. Even if we're not yelling or anything, our breath gets rapid. And then the other person's subconscious sees that. If you can just do this, that seems like a lot. I can give you a minute. Just like that. Let it out. They'll actually start to breathe with you. Sometimes in a session, if it's really wound up, I'll just stop and I blame it on myself. Oh, I'm feeling it. I'm feeling a little wound up. That was a lot that you just gave me. And you can even do this with your hand. None of you can be my patients because now you're going to see my secrets, but you can do this. And then just even a visual marker like that can help someone. Okay. It's okay to slow things down. I would say a trauma brain, the most thing you can do with a trauma brain is to slow things down. Slow things down, so that body responds. That body cannot stay in that high state of arousal for more than 7 to 13 minutes. That's it. It has to come down, the body will overheat and fall apart, so the brain has these mechanisms, and so just know that in 7 to 13 minutes, that brain will calm down. So if you can just wait that time, help that, we can go ahead and keep going. I love that question, Interestingly enough, people with autism, sometimes it's more difficult to connect from that emotional side. So being able to take that frontal lobe and use more of that logic side, that can be helpful sometimes as well. So it's a different approach. Great question. Anything else? I think we're getting ready to go, but well, thank you for your opportunity to talk, and I hope that we can all kind of have compassion and curiosity about those in our community. Thank you.